we usually talk about this a lot in our visits. Whenever you do botulinum toxin and or filler, you're going to get a good result. But when you can do Botox or toxin and filler, we can do collagen stimulators, we can add in our resurfacing lasers. Maybe you need to lose weight or our hormones. If you can do the whole package, you're going to get amazing results.
Our whole goal when we build a beauty roadmap for somebody is to help them age more naturally, and the key factor in that is truly collagen building. And you have to have all of those things in place to be able to build the collagen.
How it's going now is everybody's wanting a more natural, normal look because we've had a couple of years of weirdness.
They don't want to come in and look like Kim Kardashian, but they want to come in and look like a better themselves. On the first visit, we have them meet with myself and Krista, and sometimes with Jessica, our esthetician as well. She does a lot of our laser treatments, and so having her in there can be very helpful for a lot of the patients. But it's a long visit. We spend a lot of time talking about their habits, their history, their skin type, and what they really want to achieve.
And oftentimes we are not even treating on the first visit. If we do any treatment, it's maybe like some botulinum toxin or something little, or skincare analysis, but typically it's a good, thorough health history, and maybe we get a blood panel and we really check and see what everything is doing on the inside so we can help treat the outside. I feel like we really deep dive into the motivational reasons of why our patients want to do these treatments so that we can tailor these treatments to fit their lifestyle. We have a lot of women who play tennis, for instance, and they don't want to be tied down to treatments during the summertime, and so we adjust. We have a lot of clients that actually don't even live here, and they fly in, and so when they come in quarterly or whenever, they would like to get everything done at one time. So stacking up these multiple modality treatments is really key in maximizing results and our patients' time.
So the things that might be included in the beauty roadmap would include toxins and fillers, laser treatments such as resurfacing lasers, devices that tighten the skin, ones that help with sun damage, and then really good skincare, as well as sometimes we add in regenerative treatments like topical exosomes or peptides that can really help improve results even further. And for certain patients, some of our plans include hormone replacement as well, because as we age and our hormone goes away, we kind of lose our ability to build collagen, which is key to what we're trying to achieve for a lot of these people.
I feel like in our women who are perimenopausal and menopausal, when they neglect the hormone aspect of treatment, we are dealing with this estrogen deficient skin. And I feel like it's not addressed enough. And whenever we have patients that allow us to actually do all the modalities, we can get a better collagen build because of the testosterone supplementation and the estrogen. Everything that we employ actually has a really big scientific base. A lot of evidence-based practice behind all of the things that we recommend. Where the future is going is doing these things that create more of neocollagenesis with the regenerative therapies, with the exosomes, peptides, hormones. We do use a lot of supplements for overall gut health and hormone balancing and vitamin.
So when we bring somebody in for a consultation and we build their beauty roadmap, one of the things we do talk about is the timeline. When will they see results? How long is this going to take? We really try to personalize it for every patient that we see because everybody's a little different. Everybody has a little different starting place, has a different goal. In general, we tell people it's usually a 6 to 12 months process because what we're trying to achieve again is the collagen build, and that takes time. Now, when you do a toxin, that is fairly immediate, but fillers, biostimulators, devices, those all take time. But 6 to 12 months is a typical timeline.
Typically at the first visit in month 1, we really are focusing on skin rehabilitation. Oftentimes it's correcting just some tendencies with not wearing a hat or not wearing sunscreen and getting them on the right products, usually starting with a vitamin C, vitamin A, and usually just hydration, working on the skin barrier. Sometimes we can't even start our plan until we have rehabbed that skin barrier because we have insult due to inflammation or acne or whatever the patient has going on. We don't want to make this a laborious process, but initially if we're trying to treat an inflammatory condition, duration, we would have to have them come in every 2 to 4 weeks.
A lot of our plans when we start with somebody, like she was talking about the inflammatory process, other skin conditions that really, like melasma. If they have underlying melasma, we need to see them every 2 weeks for the first couple of months to really try to get that under control. And same thing with rosacea. The 2 devices that we use to treat that, we try to stack them where it's every 2 weeks. And if you can kind of get those types of things cleared up early, they see some really good results, then helping them navigate those last 6 months of the plan is a lot easier.
And also depending on motivation behind the patient. Some patients are very aggressive and they want results quicker. And so we do need more of a time commitment up front, and then we go to maintenance mode. Some people are happy with the quarterly, and like I said, some people earlier, they don't even live here. So when we see them, we do what we can when we can do it. We have one guy that flies in every 6 months. One interesting thing that I find lately, as of the last couple months, on people that have already been on our roadmap and they're maybe 6 months in, 9 months in, they're asking, hey, what's next? Where do I go from here? And I feel like we have definitely done a better job of laying out more of like a lifestyle plan. I feel like it just goes to show that there's not an algorithm that you can use to just inject anybody or treat anybody and get a certain result. It really has to be a tailored, individualized plan.
The people that we started with when we opened our doors are the ones that are now coming back, and really seeing how excited they've been about the changes in their skin and how they feel about themselves, and really wanting to continue and maintain the results, but also what else can we improve on. It's been pretty exciting.